Hi there, Dr. Davin Lim, board certified laser dermatologist. Thanks for watching my channel, Lasers and Lifts. I did a video a couple of weeks ago on how to treat sweating, as in excessive underarm sweating. This is part 2 of the video, and it's using a device called Miradry. So we talked about Botox. Botox is an excellent method of treating underarm sweating. It's subsidised in Australia. It works in nearly 100% of patients. And look, realistically, it's brilliant. But the problem is, it's not permanent. This treatment called Miradry is, and this is how it works. So this is serious now. So look, this is the Miradry treatment. Miradry is a company which has been around for about 4 years. It recently got approved in Australia 2 years ago. And how it works compared to Botox is completely different. It uses electromagnetic energy, and this is the device itself. It is a very comfortable treatment once we put anesthesia there. In other words, the area is infiltrated with anaesthetic, and the area is numbed with that. So how's the treatment going, mate?
Very well, thank
Very
you.
good, yeah.
Yeah, good so far.
You've had one side done?
Yep.
Yep. Cool.
Yeah, no pain.
Yep. So the treatment level, how I determine the treatment level for Miradry is basically on the amount of sweating. If he really sweats a lot, I put the treatment level up. But most importantly, the fat around the area of the axillary or the armpit area. So the deeper the setting, as in if we put the treatment level 5, did someone fart then, or was it no? No.
It's the machine.
Oh, it's the machine.
It has a concave.
Oh, okay.
Underarm.
Sorry, I thought it was Rachel. You're right. Do you want me to edit out that out of the video? Okay, we can do that. Look, so what we're doing now is that we're moving that. This has got a suction device. What happens with this machine is it actually sucks up the skin and cools the skin, but at the same time delivers electromagnetic energy. That energy heats the glands, both the eccrine and applicator glands. In other words, the sweat glands and also the odor glands. That's why we get a reduction in odor with this treatment. And once that's heated to a temperature of 67 degrees, that gland basically is destroyed. So this is how it actually works. It's using electromagnetic or microwave energy. And we work with this, you can see with the grid areas, we're working with a certain grids. Once the energy is delivered in that time frame, we move up to the next grid. So it's a very controlled and precise mechanism of destroying eccrine glands. Realistically, after 2 treatments, we're going to get a 70% improvement. Bit stingy there, mate.
Yeah, a bit.
Yeah, a bit.
Yeah.
You can tell, if a guy has tats before, generally speaking, they can tolerate anything.
It's fine.
Yeah.
Oh, just a pinch.
Very good. So here's the machine itself. Very simple to operate, simple to use. Ridiculously expensive handpiece. That handpiece alone is valued at, how much was it? 18,000.
Yeah.
18,000. So
Well,
you know,
that's insured.
yeah, it is insured.
Yeah.
Yeah, not dropped. All the electronics are within the handpiece itself. Most of the electronics are within the handpiece. That's why it's very expensive. We just had to replace one last week. 18,000. Was that you again, Rach?
Yeah.
Yeah, thanks. Okay. Anyway, guys, that's the review of Miradry. Okay, and how does this compare to Botox? Basically, this is what I tell patients. Botox is like a tap, turns it off and turns it on. Ideal candidates for Miradry are patients who have never had Botox because they get a realistic expectation of a sweat reduction rather than sweat elimination. So I like this machine for selected patients, and it's either those who failed Botox treatment or never had Botox before. In this case, this dude here, ideal candidate. So there you go, guys. Miradry, summed up. So there you have it, guys. Miradry treatment summed up. Now, I was the first doctor in Australia to be trained in Miradry. I was the first one to actually buy the Miradry machine, and I wrote the miradry.com.au website. So, do I really like this device? I don't know. The answer is depends, and I'll tell you why. It's because if someone has had Botox before, and if Botox lasts 12 to 14 months, and it is subsidised in Australia, the treatment is much better than Miradry because the patient is saving a lot more money. Apart from the monetary value, Miradry only gives you a 70% reduction in sweating, while Botox is like a tap, turns it off completely. So, I always pick the right candidate for Miradry treatment, and the ideal candidate is the person who has realistic expectations and also understands that Miradry will not give them 100% sweat reduction, but only a 70% sweat reduction. But that is for life. So that's how I choose between my Botox and my Miradry patients. Hey guys, thanks for watching this, and please remember to subscribe to my channel, and I'll keep you up to date with anything new that comes up in anything related to laser anaesthetic dermatology. Thanks once again.